If you don't need to create an invoice but want to provide a quick quotation or estimate, you can generate it from the treatment plans. Switch from the Appointments tab to the Plans tab, then create a new plan. Add procedures to your treatment plan. And if needed, group them into stages. For example, now we are doing a root canal and restoration. The first stage is a root canal, followed by the final restoration. Just like invoices, you can apply tax and discount percentages. Then print or send the plan to the patient. Once the patient approves the treatment plan, change the status to Approved to lock it from further changes. If you need to collect an upfront payment, use the Deposit menu. Now we can plan the next patient visits and follow the treatment plan. We will create another appointment. Then assign procedure with this new appointment. When it's assigned, it will automatically be merged into the patient's history in the main dental chart. From here you can continue with creating a final invoice and collecting payment.